Lung cancer is a silent killer. Every year it takes millions of lives. But what if recognizing the signs early could change everything? In fact, early detection can increase your chances of survival by up to 60%. Yet the problem is that most people don't catch it until it's too late, when the disease has already spread beyond the lungs. In today's video, we're going to uncover 10 key symptoms of lung cancer that could save your life. Whether you're at risk or just want to stay informed, knowing these signs could make all the difference. Let's dive in. Symptom 1. Severe fatigue, feeling tired all the time. It could be more than just a lack of sleep or being overworked. This could be a warning signal from your body that shouldn't be ignored. If you find yourself constantly drained, even after a full night's rest, and no amount of sleep seems to recharge you, it might be a sign of something much more serious: lung cancer. Fatigue is one of the most common and alarming symptoms associated with cancer, but it often goes unnoticed because we tend to write it off as a result of our busy lifestyles or stress. However, cancer-related fatigue is different. It's not just about feeling tired, it's a pervasive, overwhelming exhaustion that simply doesn't improve, no matter how much you rest. This exhaustion is caused by the cancer itself taxing the body's energy resources. As the tumor grows, it consumes a significant amount of energy, which depletes the body's ability to maintain normal function. Your body begins to work overtime just to keep things running, and this leads to a constant feeling of fatigue. But there's more to it. Another reason behind the severe fatigue in lung cancer patients is anemia, a condition where there is a decrease in red blood cells, which are responsible for carrying oxygen throughout the body. This is a common side effect of lung cancer, and it happens because tumors can cause internal bleeding or interfere with the body's ability to produce healthy blood cells. As a result, the levels of hemoglobin, which are responsible for transporting oxygen to tissues and organs, drop. With lower oxygen levels, your body's ability to function efficiently decreases, leading to that relentless exhaustion that never seems to go away. It doesn't end there. Cancer cells have a voracious appetite. They demand more energy than normal cells because they are rapidly multiplying. As they grow, they use up resources at a faster rate, further taxing the body and leading to an increased metabolic rate. This means your body has to work even harder just to maintain basic functions, which can be exhausting. It's like running on empty, day after day, without a chance to refuel. The fatigue from lung cancer is not like the kind of tiredness you feel after a long day of work or a restless night. It's a deep, constant, and unrelenting exhaustion that can interfere with your daily life. It can affect your ability to think clearly, do simple tasks, and even interact with loved ones. You may find yourself feeling drained after minor activities that never used to tire you out. This constant depletion of energy is a red flag that shouldn't be overlooked. So, if you're experiencing this persistent, unexplained fatigue, it could be time to talk to your doctor and get it checked out. Symptom 2. Swelling in the neck and face. Swelling in the neck and face might seem like a simple issue that could be caused by allergies, a cold, or perhaps too much salt in your diet. But if you notice swelling that's persistent or appears without a clear reason, it could actually be a symptom of something much more serious: lung cancer. The reason behind this swelling is a condition known as superior vena cava syndrome, SVCS, and it can happen when lung cancer tumors grow in certain parts of the chest. Here's how it works. The superior vena cava is a large vein that carries blood from the head, neck, upper chest, and arms back to the heart. When lung cancer develops a tumor in the upper part of the right lung, it can press against this vein, causing a blockage. This blockage prevents blood from draining properly from the upper parts of the body, leading to the accumulation of blood in the veins. As a result, you might notice visible swelling in the face, neck, or even the arms. But that's not all. Lung cancer can also spread to lymph nodes, which are small glands that are part of your body's immune system. These nodes help filter out harmful substances from your body, but when cancer cells invade them, the flow of lymphatic fluid is disrupted. This results in the buildup of lymphatic fluid, leading to swelling in the affected areas. Swelling around the neck and upper chest, especially around the collarbone, can be an indicator of this fluid retention. If you've noticed that your face or neck is swelling for no apparent reason, it's important to consider the possibility of lung cancer. What makes this symptom even more alarming is that the swelling isn't just limited to one area. It can affect both sides of the neck or even the arms. The skin may feel tight, and you might see prominent veins on your neck, which are usually not visible under normal conditions. Some people also report feeling a sense of heaviness in their chest or discomfort as they breathe. As the tumor presses more on the vein or lymph nodes, the swelling can worsen, making it increasingly noticeable. Sometimes this symptom might be mistaken for something less serious, like a common cold or sinus infection. But when the swelling is persistent and doesn't go away with typical treatments, that's when you should take notice. Swelling in the neck and face is not just about cosmetic changes. It could be a sign that cancer is already impacting vital blood flow and lymphatic drainage. The earlier you recognize this symptom, the better your chances of getting timely treatment. Even more concerning is the fact that lung cancer is often diagnosed at later stages, when symptoms like these are already more severe. By the time someone notices swelling in the neck and face, the tumor may have spread beyond the lungs. So, if you start noticing swelling around your neck, face, or even the upper chest, it's crucial to consult a healthcare professional as soon as possible. Early detection can significantly improve the outcome of lung cancer treatment. Symptom 3. Persistent or recurrent infections. Persistent or recurrent infections, particularly those affecting the respiratory system, might seem like nothing more than a bothersome cold or flu that won't go away. But if you find yourself dealing with frequent infections, such as pneumonia or bronchitis, especially if they seem to come back again and again, it could be a sign of something much more serious: lung cancer. In fact, recurrent infections are often one of the earliest signs that something is wrong with the lungs, and it's crucial to understand why these infections keep coming back. When a tumor develops in or near the airways of the lungs, it can cause a partial blockage of these air passages. Tumors in the lungs don't just take up space, they disrupt normal airflow, trapping air, mucus, and pathogens like bacteria and viruses within the lungs. This stagnation creates the perfect environment for infections to develop and thrive. Normally, the lungs are equipped with built-in defense mechanisms, such as tiny hair-like structures called cilia, which help clear out contaminants like dust, mucus, and harmful pathogens. However, when a tumor grows, it can damage or block these natural cleaning processes, reducing the lungs' ability to protect themselves from infection. As the tumor grows and more blockage occurs, it becomes harder for the body to expel these pathogens, which means the lungs are more vulnerable to infections. The constant buildup of bacteria and viruses in the airways can result in repeated episodes of respiratory infections, particularly pneumonia and bronchitis. These infections tend to persist or come back soon after treatment, and they often do not respond well to antibiotics or standard treatments because the underlying issue, lung cancer, is still there, preventing the body from healing properly. But why does this happen? The main reason for recurring infections in lung cancer patients is the impaired ability of the lungs to clear out debris and pathogens. Normally, the lungs work like a filtration system, using the cilia to push out foreign substances. However, when a tumor blocks this process, the body's defenses are compromised. The infection persists, often leading to a cycle of illness that becomes harder to treat the longer it goes on. If left unchecked, these recurring infections can lead to severe complications, including further lung damage, decreased lung function, and even the spread of the cancer to other parts of the body. Recurrent infections are often dismissed as the body simply fighting off a virus or bacteria. However, if the infections seem unusual, severe, or too frequent, it's essential to consider other underlying causes. Lung cancer isn't always easy to detect, and the symptoms often overlap with those of common respiratory infections. However, persistent or recurring infections, especially if they're not responding to conventional treatment or seem unusually severe, could be an early warning sign of lung cancer. It's critical to remember that lung cancer often progresses silently, and by the time symptoms like persistent infections show up, the disease may already be in an advanced stage. If you find yourself constantly battling infections, especially if they don't go away, it's a sign that something deeper might be wrong. The sooner you seek medical attention, the more likely you are to catch the disease in its early stages, when treatment options are still effective. Symptom 3. Persistent or recurrent infections. Persistent or recurrent infections, particularly those affecting the respiratory system, might seem like nothing more than a bothersome cold or flu that won't go away. But if you find yourself dealing with frequent infections, such as pneumonia or bronchitis, especially if they seem to come back again and again, it could be a sign of something much more serious: lung cancer. In fact, recurrent infections are often one of the earliest signs that something is wrong with the lungs, and it's crucial to understand why these infections keep coming back. When a tumor develops in or near the airways of the lungs, it can cause a partial blockage of these air passages. Tumors in the lungs don't just take up space, they disrupt normal airflow, trapping air, mucus, and pathogens like bacteria and viruses within the lungs. This stagnation creates the perfect environment for infections to develop and thrive. Normally, the lungs are equipped with built-in defense mechanisms, such as tiny hair-like structures called cilia, which help clear out contaminants like dust, mucus, and harmful pathogens. However, when a tumor grows, it can damage or block these natural cleaning processes, reducing the lungs' ability to protect themselves from infection. As the tumor grows and more blockage occurs, it becomes harder for the body to expel these pathogens, which means the lungs are more vulnerable to infections. The constant buildup of bacteria and viruses in the airways can result in repeated episodes of respiratory infections, particularly pneumonia and bronchitis. These infections tend to persist or come back soon after treatment, and they often do not respond well to antibiotics or standard treatments because the underlying issue, lung cancer, is still there, preventing the body from healing properly. But why does this happen? The main reason for recurring infections in lung cancer patients is the impaired ability of the lungs to clear out debris and pathogens. Normally, the lungs work like a filtration system, using the cilia to push out foreign substances. However, when a tumor blocks this process, the body's defenses are compromised. The infection persists, often leading to a cycle of illness that becomes harder to treat the longer it goes on. If left unchecked, these recurring infections can lead to severe complications, including further lung damage, decreased lung function, and even the spread of the cancer to other parts of the body. Recurrent infections are often dismissed as the body simply fighting off a virus or bacteria. However, if the infections seem unusual, severe, or too frequent, it's essential to consider other underlying causes. Lung cancer isn't always easy to detect, and the symptoms often overlap with those of common respiratory infections. However, persistent or recurring infections, especially if they're not responding to conventional treatment or seem unusually severe, could be an early warning sign of lung cancer. It's critical to remember that lung cancer often progresses silently, and by the time symptoms like persistent infections show up, the disease may already be in an advanced stage. If you find yourself constantly battling infections, especially if they don't go away, it's a sign that something deeper might be wrong. The sooner you seek medical attention, the more likely you are to catch the disease in its early stages, when treatment options are still effective. Symptom 4. Eye problems. Did you know that lung cancer can also cause problems with your vision? It might seem unrelated at first, but eye issues can actually be a sign that lung cancer has begun to affect areas beyond the lungs. One of the most notable ways lung cancer impacts the eyes is through a condition called Horner syndrome. This rare but serious condition occurs when a tumor, specifically a type called a Peynos tumor, presses on or affects the sympathetic nerve system, which controls certain functions in the eyes and eyelids. If you start noticing changes in your eyes, like a drooping eyelid on one side of your face, a constricted pupil, or a lack of sweating on one side of your face, it could be a sign that a tumor is disrupting your nervous system. Horner syndrome presents itself through several subtle yet distinct symptoms. One of the key signs is ptosis, or drooping of the eyelid, which might make you look tired or even cause vision issues. You may also notice that the pupil in the affected eye appears smaller than the one in the other eye, which can give the appearance of an uneven gaze. This happens because the sympathetic nerves, which control the pupil's reaction to light, become disrupted when a tumor presses against them. In addition to the drooping eyelid and constricted pupil, another symptom of Horner syndrome is a lack of sweating on one side of the face. This may sound odd, but it's a clear indicator that something is wrong with the sympathetic nervous system, and it's something that shouldn't be ignored. But the effects on the eyes don't stop there. Some lung cancer patients may experience blurred vision, difficulty focusing, or even double vision, especially if the tumor is pressing against or affecting the optic nerve or the blood vessels that support eye health. These issues often start off as subtle and may be dismissed as normal signs of aging or stress. But as the tumor grows, the pressure on the optic nerve or the blood flow to the eyes can lead to more significant and noticeable vision changes. This can make it harder to focus on objects, read, or even engage in normal activities that require clear vision. Why do tumors in the lungs affect the eyes? The answer lies in the nervous system. The sympathetic nerve chain runs along the neck and up to the face, controlling a range of functions, including pupil dilation, eyelid movement, and sweating. When a lung tumor grows and presses on or invades these nerves, it disrupts their ability to perform these vital functions. This can lead to the symptoms of Horner syndrome, which, although subtle at first, can signal the presence of a serious underlying issue, like lung cancer. If you notice any changes in your vision or facial appearance, such as drooping eyelids, unequal pupils, or a lack of sweating on one side of the face, it's important to see a doctor right away. These symptoms, although they might seem unrelated to lung cancer, could be a red flag that something more serious is happening in your body. And while changes in vision can happen for a variety of reasons, it's essential to take these symptoms seriously and have them evaluated by a healthcare professional. The earlier you catch these signs, the better the chance you have for early diagnosis and successful treatment. Symptom 5. Difficulty swallowing. Difficulty swallowing, also known as dysphagia, is more than just a minor inconvenience or the result of a dry throat. It can be a serious symptom of lung cancer. If you've started noticing that food feels stuck in your throat, or if you're having trouble swallowing liquids or solids, this could be a warning sign that something more serious is going on. While swallowing problems are common in many other conditions, when they appear suddenly or without any obvious cause, it's important to consider that lung cancer could be the underlying culprit. The connection between lung cancer and swallowing difficulties lies in the location of the tumor. When lung cancer develops, particularly in the upper part of the lungs, it can grow toward or press against the esophagus. The esophagus is the tube that carries food from your mouth to your stomach. And if a tumor in the lungs exerts pressure on this tube, it can cause a narrowing, making it difficult for food to pass smoothly. This narrowing can make swallowing painful or uncomfortable, causing food to feel as though it's stuck in the throat or chest, even when you're trying to swallow normally. But there's more to it. The esophagus shares nerve pathways with the lungs, including the vagus nerve, which is responsible for controlling the muscles involved in swallowing. If a tumor presses on or damages the vagus nerve, it can disrupt the normal rhythmic contractions that help push food down the esophagus. This disruption can lead to difficulty in swallowing, and over time, it can become harder to eat or drink without feeling discomfort or obstruction. Sometimes the pain associated with swallowing can be sharp or burning, making it even more difficult to consume food or fluids. The symptoms may start off mild. Perhaps you feel like you have a lump in your throat or like food is going down slower than usual. You might notice that certain foods are harder to swallow than others, or you might feel as if something is constantly stuck in your chest. As the cancer progresses, these symptoms tend to worsen, and swallowing can become more difficult, painful, or even impossible. The physical discomfort of trying to eat or drink can also take an emotional toll, making mealtimes stressful or embarrassing. Difficulty swallowing not only affects your ability to eat, but it can also impact your social life. Sharing a meal is a key part of social interaction, and struggling to eat in front of others can lead to feelings of isolation or frustration. It can also affect your nutrition, making it harder to maintain a healthy weight, which is already difficult when dealing with cancer. If you experience any of these symptoms, particularly if they persist or worsen over time, it's crucial to consult a doctor as soon as possible. Difficulty swallowing could indicate that the cancer has spread to or is affecting the areas of the body that control swallowing. Early intervention is critical to improving the chances of successful treatment, and the sooner you address swallowing issues, the better your quality of life will be during your diagnosis and treatment process. Symptom 6. Hoarseness or changes in voice. Hoarseness or changes in your voice might seem like something as simple as a cold or allergies, but when it persists, it could be a sign of something much more serious, lung cancer. If you've noticed that your voice sounds raspy, breathy, or weaker than usual, or if you're unable to maintain a consistent vocal pitch, this could be more than just a temporary issue. Changes in your voice, especially if they're ongoing, should never be ignored, as they could indicate a problem with the lungs or nearby structures. The main reason for hoarseness in lung cancer is due to the involvement of a nerve called the recurrent laryngeal nerve. This nerve plays a critical role in controlling the muscles of the voice box, or larynx, and it is responsible for the movements of the vocal cords. The recurrent laryngeal nerve runs close to the lungs and the lymph nodes in the chest, and it can be affected by tumors in the lungs, particularly those located in the upper left lung or those that have spread to nearby lymph nodes. When a tumor presses on or invades the recurrent laryngeal nerve, it disrupts its normal function, leading to changes in the voice. This can manifest as hoarseness, where your voice sounds raspy, strained, or unusually weak. You might notice that your voice tires more quickly, or that it's harder to project your voice clearly, even when you're not speaking loudly. In some cases, the voice can sound breathy or crack during normal speech. If you experience these symptoms, they may be a sign that the tumor is affecting the nerve responsible for voice control. But hoarseness isn't the only symptom that may accompany this condition. You might also experience a feeling of tightness in the throat, or the sensation of something being stuck, which can make it even more difficult to speak clearly. Over time, as the tumor grows or the pressure on the nerve increases, the hoarseness can become more pronounced, and may even make it hard to talk at all. This can significantly impact your ability to communicate and may begin to affect your social interactions and personal relationships. The frustration of not being able to speak normally can also lead to emotional distress and isolation. In some cases, changes in the voice can be caused by other factors, such as infections or allergies, but when the hoarseness lasts for more than a few weeks and doesn't improve with typical treatments, it should raise a red flag. It's important to understand that while hoarseness is common with respiratory infections, if it persists, it could be signaling an underlying issue that requires immediate attention. One of the challenges with lung cancer is that many of the symptoms don't appear until the disease has progressed, which makes early diagnosis difficult. If a tumor affects the recurrent laryngeal nerve, it can cause subtle, gradual changes in the voice that might not seem alarming at first. But as the cancer continues to grow and invade surrounding structures, the symptoms can worsen. So, if you notice persistent hoarseness, voice changes, or difficulty speaking clearly, it's crucial to get checked out by a healthcare professional. Early detection can significantly increase the chances of successful treatment, and addressing these symptoms sooner rather than later can make all the difference in your prognosis. The emotional toll of losing your voice or struggling to communicate effectively is something that many don't realize until they experience it. Your voice is a powerful tool in how you express yourself, and having it affected by something as serious as lung cancer can be not just physically painful, but emotionally challenging. Don't wait for the symptoms to worsen. If your voice changes or becomes hoarse for an extended period, it's time to talk to a doctor and rule out the possibility of lung cancer. Symptom 7. Changes in the appearance of fingernails. Have you noticed your fingernails looking a little different lately? Maybe they seem to be growing oddly, or they've developed a new shape. While nail changes can be due to many factors, including fungal infections or simple trauma, if your fingernails appear to be changing shape, color, or thickness without an obvious reason, it could be a sign of lung cancer. This is particularly true if you start noticing a condition called clubbing, a distinctive change in the shape of your nails that can be associated with lung cancer. Clubbing occurs when the tissue around the fingernails becomes swollen, causing the nails to curve downward and become rounded at the tips. This doesn't just happen overnight. Over time, the fingernails may become more pronounced, forming a spoon-like shape that looks quite different from your usual nail growth. The skin underneath and around the nail bed may also become softer, further contributing to the unusual appearance. It might seem like a cosmetic issue at first, but clubbing is actually a clear signal that your body is not getting enough oxygen, which can be a result of lung cancer. So why does this happen? The answer lies in the way that lung cancer affects your circulatory system. When cancer spreads to the lungs, it often disrupts the oxygen flow to your body's tissues. As the lungs struggle to function properly, the oxygen levels in the blood drop, leading to a condition called hypoxia, or low oxygen levels in the body. This lack of oxygen triggers a response from the body to try to compensate. One of the ways the body compensates is by stimulating the growth of blood vessels in the extremities, such as the fingers, in an attempt to improve oxygen delivery. This change in blood flow leads to the swelling around the nails and the abnormal growth pattern that characterizes clubbing. It's important to note that while clubbing is most commonly associated with lung cancer, it can also occur with other serious health conditions, such as heart disease, liver disease, or other lung diseases. However, when combined with other symptoms, especially those linked to the respiratory system, clubbing could be a strong indicator that lung cancer is affecting your oxygen levels. If you notice that your nails are changing shape and the condition doesn't seem to be improving, or if you notice other symptoms like shortness of breath, chronic cough, or unexplained fatigue, it's crucial to seek medical attention. Clubbing can sometimes be overlooked or misdiagnosed, especially if the person experiencing it doesn't have any other obvious symptoms. However, if the changes to your nails are accompanied by other signs like persistent coughing, unexplained weight loss, or difficulty breathing, it's essential to have it evaluated by a healthcare professional. Fingernail changes may be one of the more subtle signs of lung cancer, but when combined with other symptoms, they could be an important clue that shouldn't be ignored. If you've noticed that your nails are becoming unusually curved, thicker, or swollen, and this change isn't linked to a known injury or condition, it's important to see a doctor for further evaluation. Early detection is key in lung cancer, and symptoms like these should not be dismissed as minor issues. The sooner you get checked, the better your chances of catching the disease in its early stages, when treatment is most effective. Symptom 8. Unexpected shoulder or arm pain. Shoulder or arm pain is often dismissed as a simple muscle strain, a result of poor posture, or even a sign of stress. But when the pain is persistent, unexplained, or doesn't seem to correlate with any obvious injury or strain, it could be a sign of something much more serious: lung cancer. This type of pain is particularly concerning when it's localized to one side of the body, especially if it occurs alongside other respiratory symptoms, such as a chronic cough, shortness of breath, or chest pain. One of the key reasons shoulder or arm pain can be associated with lung cancer is the presence of a rare but distinct type of tumor known as a Pancoast tumor. Pancoast tumors are located at the apex, or top part of the lungs, and they have a unique ability to affect the surrounding structures, including nerves that control sensations and movements in the shoulder and upper limbs. These tumors are located in a region of the lung that is close to a network of nerves called the brachial plexus, which is responsible for controlling the muscles and sensation in the arms, shoulders, and hands. When a Pancoast tumor grows, it can press against or invade the brachial plexus, which leads to significant pain and discomfort. The pain associated with Pancoast tumors is often described as a deep, aching soreness or a sharp shooting pain that radiates down the arm or into the shoulder. It may start off as a dull ache, but as the tumor continues to grow and press on the nerves, the pain can become constant and much more severe. In some cases, the pain might worsen with certain movements, such as lifting the arm or reaching for something. This type of pain can also intensify at night, making it difficult to sleep, which only adds to the overall discomfort and frustration. In addition to the pain, individuals with Pancoast tumors often experience other symptoms related to nerve involvement. These can include numbness, tingling, or a feeling of weakness in the shoulder, arm, or hand. This occurs because the tumor disrupts the normal nerve signals that control movement and sensation in these areas. As the tumor invades the brachial plexus, the nerves become damaged, leading to a loss of feeling or a sensation of weakness in the affected arm or shoulder. In severe cases, the person may have difficulty using their arm, and it may feel heavy or unresponsive. This can affect daily activities, from lifting objects to simply moving the arm comfortably. The relationship between shoulder or arm pain and lung cancer can be easily overlooked, especially because many people assume the pain is simply due to poor posture or muscular strain. However, this type of pain should not be ignored, particularly if it is unexplained or worsens over time. One of the challenges with Pancoast tumors is that they don't always cause obvious respiratory symptoms in the early stages. Many people with these tumors may not experience a cough or shortness of breath until the tumor has grown significantly. Because of this, the pain in the shoulder or arm may be one of the first symptoms to appear, making it an important early warning sign. It's important to understand that Pancoast tumors are a rare form of lung cancer, but when they do occur, they can be particularly aggressive due to their location. The tumors are often found in the upper lobes of the lungs, and they have the potential to invade nearby tissues, including the ribs, spine, and nerves. While shoulder or arm pain caused by a Pancoast tumor might seem like a localized issue, it can actually be a reflection of a much larger problem, and it may be an indication that the cancer has already spread beyond the lungs. The pain caused by Pancoast tumors can be especially disruptive to daily life, making it difficult to perform routine tasks or enjoy activities that require arm movement. Over time, the pain can cause a person to alter their posture or movement patterns in an attempt to avoid discomfort, which can lead to muscle imbalances or additional strain. This can create a vicious cycle where the pain worsens and the person is unable to find relief. If you've been experiencing persistent shoulder or arm pain that doesn't seem to have an obvious cause, it's important to seek medical attention. While this type of pain can be caused by a variety of conditions, if it's accompanied by other symptoms such as unexplained weight loss, chronic cough, or difficulty breathing, it could be a sign that lung cancer, specifically a Pancoast tumor, is affecting your body. The earlier you identify the issue, the more likely you are to catch it before it becomes more advanced, giving you a better chance at effective treatment and improved outcomes. If shoulder or arm pain is affecting your quality of life, don't wait for the pain to subside on its own or for other symptoms to develop. Consult with a doctor as soon as possible to rule out lung cancer or any other serious conditions. Early detection is key when it comes to lung cancer, and understanding the warning signs, like unexplained shoulder or arm pain, could be the first step in getting the help you need. Symptom 9. Worsening bone pain. Worsening bone pain can be incredibly debilitating, making even the simplest of daily activities excruciating. If you've been experiencing pain in your bones that doesn't seem to go away, or if the pain has been intensifying over time, it's crucial to pay attention. This could be a sign that lung cancer has spread beyond the lungs and into the bones. This process is known as bone metastasis, and it's one of the ways in which lung cancer can become more aggressive and harder to treat. Bone pain that occurs due to lung cancer metastasis is typically felt in weight-bearing bones, such as the spine, hips, or legs. The pain often starts as a dull ache that progressively worsens, and it may be accompanied by an increased sensitivity to touch or pressure in the affected areas. In some cases, the pain can become so intense that it interferes with sleep or causes difficulty moving around. The discomfort may become constant, and the pain may worsen when the person engages in physical activity or even during normal movements, like standing or sitting. But why does lung cancer spread to the bones in the first place? When cancer cells from the primary tumor in the lungs break away, they enter the bloodstream or lymphatic system, which acts as a pathway for the cancer cells to travel to other parts of the body. Once these cells reach the bones, they can begin to form secondary tumors. The bones are a common site for metastasis because they have a rich blood supply, making it easier for cancer cells to settle and grow. When these cancer cells invade the bones, they disrupt the normal balance of bone breakdown and rebuilding, which results in pain and weakening of the bone structure. The bone pain associated with lung cancer metastasis can be very distinct. As the cancer cells grow within the bones, they can cause the bone tissue to weaken, which makes the bones more vulnerable to fractures. This means that bone pain can often be a warning sign that the bone is becoming fragile or at risk of breaking. If you experience sudden, severe pain, or if you've developed a fracture with minimal injury, it could be related to cancer spreading to the bones. Another factor that contributes to the bone pain is the release of certain substances by the cancer cells. These substances, known as cytokines, activate a type of cell in the bone called osteoclasts, which are responsible for breaking down bone tissue. When these osteoclasts become overactive, they lead to excessive bone resorption, which weakens the bones and results in pain. As the bone breaks down, it can become more susceptible to damage and fractures, making the pain even worse. Pain from bone metastasis often has a profound impact on a person's quality of life. Simple movements like bending down, walking, or even sitting for extended periods can become excruciating. The chronic nature of this pain can lead to significant physical limitations, making it harder for people to perform everyday tasks. care for themselves, or even engage in activities they once enjoyed. This persistent pain can also take an emotional toll, leading to feelings of frustration, anxiety, and depression as the person struggles to cope with both the physical and mental challenges that come with it. The bone pain from lung cancer is often accompanied by other systemic symptoms of cancer, such as unexplained weight loss, fatigue, or difficulty breathing. However, sometimes bone pain can be one of the first symptoms to arise, especially in cases where the cancer has already spread to the bones before the lung tumor is diagnosed. This is why it's so important to recognize the signs of worsening bone pain and to seek medical attention immediately. The earlier bone metastasis is detected, the more options there are for managing the pain and addressing the underlying cause. If you notice that your bone pain is worsening, or if it's accompanied by other symptoms like unexplained weight loss, fatigue, or shortness of breath, it's crucial to consult a healthcare provider right away. Bone metastasis from lung cancer is a serious complication, but with early detection, pain can be managed and treatment options can be explored to help improve your quality of life. Don't dismiss chronic or worsening bone pain as just a result of aging or general wear and tear. If you're experiencing these symptoms, it's essential to get checked out as soon as possible. Symptom 10. Unexplained weight changes. Unexplained weight changes, whether you're losing weight without trying or gaining weight inexplicably, can be a major red flag for serious health issues, including lung cancer. While weight fluctuations can be linked to a variety of factors such as diet, exercise, or stress, when they occur without any obvious cause, it's important to investigate further. Lung cancer, in particular, can lead to significant and unexplained weight changes that can be concerning and difficult to ignore. Unexplained weight loss is one of the most common symptoms associated with cancer, including lung cancer. In fact, weight loss is considered a classic sign of advanced stage cancer. When cancer cells are present in the body, they require a lot of energy to grow and multiply. As a result, the body's metabolism speeds up in an effort to meet the energy demands of the growing tumors. This increased metabolic rate causes the body to burn calories at a faster rate than normal, even without changes in diet or physical activity. As the cancer progresses, the body's ability to maintain its usual weight becomes compromised, leading to noticeable weight loss. This weight loss is often not due to a lack of appetite, but rather the body's inability to absorb or retain nutrients. Cancer cells often interfere with normal digestion and nutrient absorption by disrupting the function of the digestive system. They can also cause nausea, vomiting, and a loss of appetite, which further contributes to weight loss. In some cases, the body may not be able to retain the nutrients from food even if you're eating regularly, which leads to the progressive loss of both fat and muscle mass. This condition, known as cachexia, is common in people with advanced cancer and can result in extreme weight loss, weakness, and fatigue. But weight changes aren't always about losing weight. Some people with lung cancer experience unexpected weight gain. This may sound counterintuitive, especially when you think of cancer as being linked to weight loss. But the truth is that lung cancer can also lead to weight gain due to hormonal changes triggered by the cancer. Some lung tumors produce hormones that disrupt the body's normal functioning. For example, certain types of lung cancer can lead to a condition known as Cushing syndrome, in which the body produces an excess of cortisol, the stress hormone. High cortisol levels can cause the body to retain fat, particularly in the abdominal area, leading to noticeable weight gain around the belly and face. You might notice that your face becomes rounder or that you develop a buffalo hump at the back of your neck, a common sign of Cushing syndrome. Additionally, weight gain can occur in lung cancer patients who experience fluid retention caused by the cancer. When tumors grow, they can sometimes block the lymphatic system, which normally helps drain excess fluid from the body. If the lymphatic system is impaired, it can lead to swelling and fluid buildup, which may manifest as weight gain. This is often referred to as edema, and it can cause swelling in the legs, feet, abdomen, or face. This type of fluid retention can also lead to a false sense of weight gain, as the body accumulates fluid without actually gaining fat. It's important to note that both weight loss and weight gain associated with lung cancer can be accompanied by other symptoms such as fatigue, changes in appetite, nausea, and general weakness. These symptoms often signal that cancer is advancing, and the body is struggling to cope with the disease. Whether you're experiencing unexpected weight loss or weight gain, it's essential to pay attention to these changes and seek medical attention. Weight changes alone may not point to lung cancer, but when combined with other symptoms like persistent coughing, shortness of breath, or chest pain, they can be a key indication that something more serious is going on. If you've noticed any unexplained weight changes, whether it's rapid weight loss, unexpected weight gain, or both, don't wait for other symptoms to appear before seeking medical help. Early detection of lung cancer can significantly increase the chances of successful treatment, and recognizing the warning signs, like unexplained weight fluctuations, can make all the difference. Consult with a healthcare professional if you've experienced these changes, especially if they persist or worsen. The earlier you catch the problem, the more likely you are to address the underlying issue and improve your outcome. Lung cancer is a silent threat, often hiding in plain sight. Many of its symptoms are subtle, and without awareness, they can be easily overlooked. But recognizing the warning signs early can make all the difference. Early detection means better treatment options and improved chances for survival. If you've noticed any of the symptoms we discussed, please don't ignore them. Consult a healthcare professional as soon as possible. This disease affects millions, but with awareness we can make a change. If this video helped you, share it with someone you care about. It might just save their life. Don't forget to subscribe to Health Insight Explorers for more crucial health tips and hit the notification bell so you never miss an update. Your health matters. Take action today. Stay informed, stay healthy, and remember, you're not alone in this fight. Let's beat cancer together. See you in the next video.